I want to talk about some of the efforts to really understand COVID-19 infections in people who have or are at high risk for lung cancer.
It's still early, right? People are just being diagnosed with cases, but already we've seen these great mobilizations of the research community to start to understand the really important critical questions for our community. And that's so great to see and so important for the future. So we're seeing efforts to track cases of COVID-19 in patients with cancer. One is called CCC19, which is a cross-cancer registry of patients with all different types of cancer globally who are also diagnosed with COVID-19. But one more specific to our community is called TERAVOLT, which is just patients who have been diagnosed with lung cancer and also now have a COVID-19 infection. And these types of new consortia and researcher collaborations are going to be really important as we move forward and try to learn how to manage the disease both at the time of infection as well as long term. So we've been talking with the TERAVOLT investigators, and what they're doing right now is it is all surveys of the medical professionals who've been treating these patients to understand the clinical course of their COVID-19 infection, as well as how that was managed and how their lung cancer was managed during that time. And we're very quickly learning from these patients. So those investigators actually already have over 200 patients and have written up their first manuscript on what it looks like to have COVID-19 infection and lung cancer. That's an effort that's across 19 different centers in 9 countries. Moving forward, we're going to have the ability to be able to track what patients are saying and what you're thinking and how people are managing the COVID infections in the lung cancer community from the patient perspective moving forward. So we're really excited about that. That will launch in hopefully a few weeks to a month on the TERAVOLT website. And it's an effort that we're really looking forward to. As what you and I, Danielle, spoke about earlier, we really want to follow patients over time to understand their patient-reported outcomes as well as the clinical outcomes that are being reported by the medical community. And both sets of outcomes are really important for the full picture of what survivorship of lung cancer by itself, but also of lung cancer after COVID-19 infection will look like. I think we don't fully understand the impact of the infection itself. We don't yet understand the biology of how the COVID-19 infection will impact lung cancer. We don't understand what the treatment delays may result in. There's many, many, many research questions. And it just goes to show that the future mobilization of research, when we can all get closer back to normal, as Amy talked about, is so important. And investment in research at this time continues to be a really important area because there will be so many questions as we're coming out of the stay-at-home orders that we're in now.